I'm Anon Mayer, and I'm a licensed marriage and family therapist.
Hi, my name is Lucy Guadalupe, and I'm a licensed associate marriage and family therapist.
Hi, my name is Adia Williams, and I'm a licensed associate marriage and family therapist.
Hi, I'm Chantal Lang, and I'm a licensed associate marriage and family therapist.
And you're listening to Mental Breakdown.
So let's talk a little bit about just, what clients can expect in the first session, why we do consultations, and maybe we start with why do you guys do consultations? Because I think that's something we've been running into of people just want to schedule or they really want to do the consultation. So what do you guys think about those, or what feedback do you have?
I can jump in.
Yeah.
I love doing consultation calls. I always do them. I feel like it's super helpful for me and also the client in kind of determining that initial, is this a good fit? Is this not a good fit?
Yeah.
Hearing a little bit more about what the concerns are, what they're interested in. I feel like a huge factor to beneficial therapy is having therapeutic rapport and a therapeutic relationship that feels right and fitting.
Yeah.
Between the therapist and the client. And I think therapists are not one size fits all at all. And it's important to trust to go through that process and see okay, actually I don't know if this therapist feels right for me, or I feel like I really connected with this therapist. Because I think being able to build that sense of safety is super crucial.
Yeah.
To the progress and to the healing and the journey and all the things.
Well, and it's the number one predictor of therapeutic success, like you said, is that fit with a therapist.
A little bit different, but I utilize the intake appointment, or not the intake appointment, the consultation as a way to get those initial pressing questions out of the way first. Do you take my insurance? Are we doing cash pay? Are we doing insurance pay? When scheduling, explaining the process of the intake paperwork and kind of all these things that you could either go back and forth with in an email, or you could do in the initial session. Although then, in terms of the conversation over email, that can be a lot of back and forth, opposed to just doing it in a 15-minute phone call, as well as in the intake appointment. Then you're going to utilize that entire intake appointment, just getting through the logistical stuff, which no one wants to do. So I like to get that out of the way in the consultation call, because also sometimes people don't know things like our rate. Mm-hmm. And so then in that phone call, they might ask that question. And then if it's not fitting for them, right, and it's too expensive or whatever, then we know I can give them referrals and it's not going to be a good fit for that reason.
Yeah.
Which then also saves them time and money, right? Because if they come in for that initial intake appointment, maybe not think about or consider the cost, and then they're like, wait, I can't afford this. And now they've had to spend that money. They've had to kind of waste their time filling out the paperwork, all of that stuff, which can just be, that logistical stuff can be frustrating and annoying. And so just using that 15 minutes to kind of get it all out of the way and set the client up for success to be able to get in and really just start working on things.
Yeah. And I think adding on to a little bit of what everyone said, it's just as much an opportunity for, us to get to know your goals, what you want to focus on, so that we can make sure we're providing the best care possible, or give referrals like Lucy was saying.
Yeah.
But on the other side, it's just as much for the potential client to get a feel for, what's beyond just our background information, and ask questions about what the feel of therapy is going to be like, and for us to learn more about if they've gone to therapy before, what have they liked that previous therapists have done, and what hasn't really landed well with them. So I think, to what everyone's saying too, it gives us the best opportunity, if we decide it's a right fit, to have a really successful and aligned intake session.
Well, and I think a lot of times clients think that we do everything. Oh, you're a therapist, so you treat everything under the sun. And it's no, we really don't. I know our practice doesn't treat eating disorders. We don't do a lot of substance abuse. We don't work with a lot of domestic violence offenders. And so I think those initial consults are really good to kind of ask some of those questions. Or if we have a client that's reaching out that has had a couple suicide attempts and is actively suicidal, that isn't something that like we can meet that level of need or that level of care. Mm-hmm. And so having, like Lucy said, that free 15 minutes to really determine, are we the best fit for the client, and is the client a good fit for us too? It goes both ways.
Yeah. Some therapeutic lingo that people might not understand or know what it means, like being in our scope of practice, right? And so if we're treating something, for example, I don't treat suicidal ideation or self-harm. And so that is, I don't specialize in it. I haven't done any type of continued education in it. And so that is something that is technically out of my scope of practice to treat on a severe level, right? So that would be, if you did a consultation with me, I would need to provide you more fitting referrals for someone that specializes in what you're needing treatment for.
Yeah. Well, and like I've done a lot of work in my previous therapy life with substance abuse. And so I have a few clients where there is some substance abuse happening. And even with my history, it's kind of like, okay, but at what point is it outside of my scope? Because I haven't done continuing education. Like I'm familiar enough with it. I've done enough work with experience. But like at what point do I need to refer to a specialist for that? And sometimes, that information comes out in the initial consult. Sometimes it comes out when we've already started therapy, and then we make those referrals then too. Are there any times you guys don't do an initial consultation? Because I can think for me, like if I get a referral from like a close colleague, I won't do an initial consult. Or if I get a referral from like a client, because I have one client that sends me a ton of referrals just through their organization. So with them, I probably don't do initial consultations, but I'm wondering for you guys if you guys have any situations like that.
I would say if one of you guys is like, we have had in our practice situations where like one of us is working with a couple and individual therapy is recommended at some point. In those situations, I don't always do a consultation. But I feel like that's probably a limit for me.
Yeah. And it's not super common. We do share a lot of referrals, but, typically we get a release and that's like, hey, like, I'm going to give you this client. Here's a little bit of background. So it's not like you're going into it just kind of blindly either.
Yeah. I personally do always, at least at this point, require an initial consultation, mostly just for the logistical stuff. I just find that it's so much easier to send them back an email and say, hey, let's get on the phone for 50, even if I know that it's going to be a good therapeutic fit or it was a close referral from a colleague, let's hop on the phone for 15 minutes to get this logistical stuff out of the way.
Yeah.
So that then we don't have to send 15 emails back and forth about it. And I feel like, if you've never done therapy before, sometimes you don't understand or know, like, oh, I have to complete, 12 intake forms and I have to do these things. And how do I create my client portal and all of that? And so it's just a much easier process for me to have that 15 minutes to walk them through all of that and give them any sort of direction that they need, if they need to get in connection with our billing department, all of that. And so I do. Just because it makes my life easier, and I think it makes their life a little bit easier too.
Yeah. I need to be like Lucy when I grow up.
Oh man, yeah. I'm just not, I just do not like emailing back and forth. I'm sure all my clients know that. It's just
so funny.
Let's just hop on the phone.
Yeah. Well, and I do think there's a lot of things where phone calls can be easier. I think just to like clear it up and all of that stuff. I just am like so bad at phone calls where I'm like, can we email? Can we text? Can we do other things? So
yeah. Also, and sometimes people don't even think about this, like the address of our office, and we don't have a receptionist at our office. We just have like an iPad that you check in on. And so I always like to tell people like the process of when they arrive and checking in, because that's how you let your therapist know that you've arrived in the office.
I know, because we're fancy.
We are fancy.
I say that like I'm in person. I'm never there, but I need to actually take my picture off the receptionist so people don't get the wrong idea that I'm actually in the office. But no, I do think that's a good thing to go over in the consultation too. And so, because I think sometimes people will come in and like, I don't remember I think Chantal, it was you. You had a client who like didn't know to check in and then was just kind of like hanging out and
yeah.
Yeah.
Had to go track them down, yeah.
Yeah. So what do you guys, like, how would you describe what happens from a first session forward? Like if there was a potential new client on the call now, what would you guys describe, or how would you describe that process?
I mean, if anybody wants to jump in first, this is a question I feel like I have gotten quite a bit in an initial consultation, because honestly, I feel like sometimes there is so much pre-therapy anticipatory anxiety, and then you add on just like already the life stressors that they're experiencing and the things that they're going through and the pain and all the things, and it's like taking that first step into the office is sometimes like into the video call is sometimes like the hardest part. And there's so much fear, I think, especially if a client has never done therapy before at all and it's like a completely new experience. Maybe they have like preconceived notions, like thinking about our talk about all the therapy myths. I think there is a lot of information out there that people get from like media and things where it's like, what does therapy actually look like? So I love when a client asks that question of like, can I get some kind of like idea of what to expect? And honestly, I feel like it's going to look a little bit different client to client, which is a hard answer that I usually give, is like it is going to look different depending on the situation. Because if somebody is coming in crisis mode and there is like risk and safety concerns, that intake session is going to look different than somebody who is coming in not in crisis and they're rather like, let's talk about the goals and kind of setting up. I think intake is a lot of exploring, a lot of assessment. So I talk about that. I'll usually say, you know, when you come in, we'll talk a little bit about the informed consent. You know, if you have any questions of anything that you filled out, happy to answer them. I'll walk through my housekeeping spiel about confidentiality and all of the boring things that are important. And then I usually will just kind of, depending where, also kind of just depends like the client's vibe. I think some people are really ready to come in and say like, these are the things. And for other people, it's like, I don't know where to start. I've never done therapy before. So with those clients, I will give prompts or I'll ask more questions, so that they're not feeling like they're just sitting there trying to come up with things.
And we're not going to let a client just sit and like, we're not just going to sit in silence for an hour, you know, and
great. Absolutely not. And I feel like that is like a big misconception and people fear that. They're like, or if a client wants to start therapy, has a lot of things going on, they're super stressed out and they're like, I don't know exactly like what my goals are.
That's okay.
Intake is a time to like, let's just explore some different things and see, like, you don't have to know what your goals are for therapy immediately. That can be something that develops and changes over time. And honestly, it probably should develop and change over time. So that was kind of like a long-winded answer, but
I love it.
It really depends.
I love it. Well, and I think, like, I'm thinking of couples, for example. Like, I always tell couples in the first session, like, I am going to be sitting back a little bit more the first few sessions, because I'm watching, right? I'm taking in a lot of information. So there are going to be things that I'm going to let you guys talk about, or I'm going to let a dynamic play out, as long as it's safe. But I'm going to be watching, right? Because I'm making notes of, you know, what's happening within their cycle, what are potential underlying raw spots, traumas, things like that, things that I want to explore. And then I'll tell couples, like, after that, I'm going to be all up in your business. So I'm going to be, like, jumping in, I'm going to be stopping you, I'm going to be directing, like, I'm going to be doing all of this. So it is going to look different from the first few couple sessions to later sessions. And I think even with individuals, kids, families, you know, kind of that same thing where at the beginning we are taking in, it's like information gathering and rapport building, you know, getting information, helping the client feel safe. And then we're going to start, you know, like moving in a direction, or maybe like giving some more direct feedback, or getting curious, or asking questions. But, you know, and I think I know the way that we all do therapy, just because we've been working together for a long time, where I think we always try to go at the client's speed. And I think that's a question that we get too, is like, do I have to be done by like a certain time? And it's like, no, like we're going to work at your pace.
Totally.
Mm-hmm.
That actually reminds me, hearing you talk about that, and then I'll zip it.
You don't have to zip it.
One thing I feel like is really important in sometimes like the consultation or that like initial intake session, but always like beginning stages of therapy that I'll mention, is that the beginning stages of therapy are still like the first few sessions are still
assessment.
In this considered assessment stage, where like I realistically can't get all the information from just your paperwork or that initial consultation call.
Mm-hmm.
Sometimes they're really thorough, some aren't. Either one is fine, but there are times where maybe in that initial consultation it feels like a good fit, and then 2 sessions down the line something comes to light where it's like, okay, actually this is needing a different level of care, or this isn't actually something that I work within my scope of practice.
Mm-hmm.
So I usually tell clients that early on, because that sets it up smoother down the line if something like that does come up, where it's like, okay, now we might need to pivot a little bit. But yeah.
Well, and I think that's a good reminder, because one of the things that we have to do as therapists is we should not be abandoning our clients. So it's not like we can just be like, I'm done with you, I don't ever want to see you again, and not have a reason or a transition. And so in that assessment period, we are, doing the best that we can do to make sure, like, is this a good fit? Is this client in the right hands? And sometimes there might be a different thing that comes to light, like let's say an eating disorder, where we might be able to work on like the trauma piece of it, or, any other kind of like relationship, stress, whatever. But we're going to refer you to an eating disorder specialist to work on that. And then let's have a release of information so that we can coordinate, not necessarily like, I'm done with you, go over here. Right. But I think that assessment period is really important. And I've had clients where like I find stuff out, we're 6 months into therapy and I'm like, oh, this makes a lot of sense why we've been doing this work, but for them, it's something that had been so normal that it's like, it wasn't even registering as a problem.
Totally.
Mm-hmm. Lucy, Chantal, what do you guys think about, what would you tell clients to expect like from a first session?
I feel like the question I get a lot, typically in the consultation, is like, what are the first couple sessions going to look like, or
Mm-hmm.
what's the therapy process going to look like? And obviously, as Adia said, like that first intake appointment, we're going over the informed consent, all of that. But then what we're doing is throughout pretty much like the first and second session is what's called a biopsychosocial assessment. So we're really, the questions that we're asking you, they may seem obvious, right? Or maybe they're just very like sometimes boring questions, but we are trying to get to know everything about mm-hmm. your physical health, your mental health, your social life, your family dynamics, your marriage, your relationships, what your work environment, all of these contributing factors that could be playing into what your presenting concerns are for therapy, and then can also, help me as your therapist, help you to figure out what your goals are for therapy, because it is collaborative, right? Yeah. Like you might come in and have goals, but after I perform that biopsychosocial assessment, I might be able to track or assess something different that you haven't recognized or acknowledged that might need to be addressed or worked on. And a lot of times that might be underlying trauma. And then, so that's kind of like the first and second session. And honestly, as you guys were saying, ongoing mm-hmm. for forever throughout the process. And then typically in that third session, and this isn't always the case, but doing that treatment plan. So really establishing like, what are we going to be working on in therapy, and having goals in place so that we know what we're working towards and taking active steps towards getting there.
Yeah, and I think too, something I notice I say a lot in intake sessions is we're gonna be slowing down a little bit so that it allows us to speed up later. And so I say a lot of like, okay, walk me through your cast of characters and who are the people in your life and your support systems, and really going back. And I think a lot of times too, clients in feedback that I've heard is they like when they're given that space to have that reflection, that a lot of times if they've either not gone to therapy or it's been a while, they mm-hmm. haven't really had a space to truly do that in an uninterrupted format with someone that is genuinely curious. about their life experiences and what goes on. So I feel like the intake, as everyone's saying, just gives you a lot of opportunity to also, as the client, get curious about yourself, and maybe something comes up that you're bringing up, like Lucy said, in the bio part of the biopsychosocial assessment, that you're like, oh, I guess I haven't been sleeping really well, and that's not something I would have necessarily like pulled out, but let's figure out when that kind of started. So I think it also depends a lot on the client's age. So if we're seeing a younger kid, a teen versus an adult, that's also something that I feel like is really important for us to explain if there are parents or guardians and caregivers involved, of the intake sessions, and that, 4 to 5 sessions. It's going to look very different as we're understanding a child or a teen's inner world versus an adult. And so just making sure everyone's on the same page there too.
Yeah, that's very true. And I do work with kids a lot, so I can kind of touch on that piece, because it does look, and I'm glad Manon touched on the couples, because it does look different. And so typically if I'm working with a family or kids or a child specifically, that first session will more than likely be with the parents or one of the parents, where I'm just getting an idea from the parental perspective on like what's going on, what the goals are, what the presenting concerns are. And then from there, after that, I'll probably be just solely focusing on building rapport with that kiddo. So that might be just playing games, just doing some type of play therapy, but we're obviously not going to take the same approach with a kid or a teen that we would with an adult. We're not going to sit there and just be asking questions, which that sounds so, it's still great when you're an adult, but right, it's just through a different type of interaction. It's not just direct conversations. I sometimes wonder if my parents think that, not my parents, the parents of my kids think that, like that I just sit there with their child the same way I do with them. And it's like, no, we're, playing and interacting and doing things that are developmentally and age appropriate for, whoever the kiddo is.
Well, and we might be talking about things that are not even related to like the current family system. Like I remember talking to a kid about Minecraft. Like, and this was like years ago, and I know Minecraft is still a big thing because like my oldest son plays it with his friends at college and all that stuff, whatever. But I remember like that was the focus of most of our sessions for like the first couple months, because the kid was like building rapport and feeling safe, and that was a safe topic to talk about. So I learned way more than Minecraft than I ever thought I would ever learn about it. But then having to tell the parents like, hey, here's why we're doing this. It's that rapport building, it's that safety, it's all of that. And kids really need that, because as adults, they're going to come in and think like we work for the parents and we're going to tell the parents everything. And it's like, yes and no. Like we are going to be communicating with the family, but it's not like we have an agenda that's 100% aligned with the parents. We're there for the identified client or for the system. Yeah.
I think I love all of what you guys are saying, and I agree with all of it. I would add something that like came to my mind with couples. I'm bouncing around a little bit. I think it can be helpful in the first session to also let them know that sometimes couples therapy is going to feel unbalanced.
Yeah.
I think, at least in my experience, sometimes I've had couples come in where I think people just come into therapy sometimes with like an idea of how this is going to go. And like my therapist is going to validate everything I say.
They're going to be on my side. They're going to tell my partner what to do.
Wake up call. And sometimes it doesn't go that way. And sometimes it is this back and forth kind of like pendulum. And there is a reason for that. It's super important for perspective taking. And sometimes people do need to be called out or challenged. And it doesn't always look dating. And so it might at times feel unbalanced, and the pendulum will swing. Like, it's important to know, like, the therapist is always neutral and unbiased and not siding. Even if it feels like at times one client is being challenged more, like one partner in this couple is being challenged more, doesn't mean therapist is, like, on this other person's side. It's really for perspective taking. And always the umbrella idea is like we want to help the couple as a system, as a team.
That's the client.
Totally. So it does look a little bit different than if you were just seeing an individual.
Mm-hmm. And I think that's a really good thing to put out in like the first couple session, you know, and to say exactly what you said, because there are going to be times where one partner is going to feel like they're getting picked on or they're in the hot seat. And like you said, we know that, and we don't want to keep one partner in the hot seat the whole time, but there are going to be times where, you know, we have to have some hard conversations with a partner because maybe they're talking in a way that's aggressive, or it's not helpful, or, you know, they're stuck in like a victim like mentality. And so being able to have those conversations too. You know, Chantal and I were talking in supervision earlier about how sometimes for guys, their hurt comes out as anger. And so I'm thinking of that in a couple session where, you know, they might be in the hot seat because we're exploring the anger, where really we're trying to get them to that deeper pain point of hurt, where they're going to feel like they're in the hot seat, and just kind of explaining our process along the way so they don't feel like we're against them.
Yeah. Yeah, I feel like anything that you can do to like just set up that expectation helps. Mm-hmm. Because again, it's like never coming from this place of I'm siding with this person or I connect with this client more. It's like, no, I'm working for the client as a couple unit. And so it is naturally going to feel unbalanced at times, and that's totally normal. And just know that there's a reason for it.
I find, and I'm just going to do a whole disclosure right now, so you guys can tell me to shut up if this feels inappropriate, but I feel like I have a hard time with that when there is a partner with a personality disorder that's being like aggressive and unreasonable. For me personally as a therapist, I'm like, okay, stay neutral, stay neutral, stay neutral, but this is so abusive, or it's so aggressive, or it's so irrational that it's hard for me to stay totally neutral. And I don't know if you guys experience that with anything, or if you guys even feel comfortable talking about it. So it's like I'm always trying to remind myself of like, okay, it's the relationship. Or sometimes I'll just kind of put it out there. Like, look, I really want to be on your side, and it's hard to do that right now.
Right. Actually, I feel like that is good that you do that, because it means that you have awareness to your transference. Maybe. That is like a very big, very important part of therapy. Like that's something I remember in grad school days, like they talk about a lot. It's like, know your limitations, know things that trigger you as a therapist. Because if you are just like completely unaware of that and you're just going with it, then how can you check those things? You know what I mean? So I think that's normal, especially in situations where somebody is abusive. That isn't going to be a neutral conversation. If there is like domestic violence going on, or, you know, psychological abuse, like that is a very different conversation.
For sure. Well, and
it's gonna feel more urgent than this like just unbalancing for perspective taking reasons.
Right. I totally like rolled my eyes and shook my head, and that was not at you, Adia. That was at like the whole. I was like, gosh, that looks so rude. That wasn't at you. That was at the situation. Well, and I think yes to all of that, and I'm actually thinking of like a specific example where, like, it felt like there wasn't, I don't even know how to say this appropriately. Like there wasn't like a touch of reality. Like it was such distorted thinking. It was such distorted reality, perceptions that really fueled this like victim mentality, but then also like really aggressive, like verbal, emotional behaviors, threats, things like that, where that it's like, how do you work with that? And it turns out I didn't. I referred them out because I'm like, this is outside of my scope. Mm-hmm. But it was hard. Like it was hard in that moment to like stay neutral. I'm like, stay neutral, stay neutral, stay neutral. And like every part of me wanted to be like, what you're doing is so not okay. But I didn't say that. Mm-hmm. So that got off of like what to expect in a first session. I totally took us on a whole tangent. I apologize. But I wonder, well, I guess my brain's going in a couple different directions, because one thing that I'm thinking about is, you know, what's off limits to talk about in a first session? Is there anything that you guys come to mind? Because I'm thinking like nothing is off limits.
No, I usually tell clients nothing is off limits, and I will probably not be shocked and floored by anything. Like you can literally talk about anything that you want to talk about, and I can hold space for that. Like it is.
And you've had some wild things thrown out in sessions.
I have. And I'm totally fine with it. Like, let's talk about it.
I mean, the joke is, like, you always get the wildest ones, like, out of all of us. Like, Yeah. And you
I'm okay
handle
with
it so well.
That is, yeah, I always say nothing's off limits.
Yeah.
Like, go for it. Like, if there's a space for it, that is therapy with somebody who is not judging you, who is unbiased to these things, who my goal is literally to help you.
Mm-hmm.
So if there is something, even if it's uncomfortable or feels taboo, it probably isn't.
Yeah.
And it definitely isn't making me uncomfortable to talk about it.
No, it takes a lot to make us uncomfortable.
Yeah.
Yeah, and I don't know if that's something that people always realize, especially if something's been like so taboo in their, circle of life, and it's sometimes like the first time they're sharing it with someone. But I know Adia and Lucy, you both told me this like very early on, of like therapy only works when there is trust, and they are willing and open to like take the dive of, I've never said this to someone, but I'm going to reveal it to you. And part of it is like from the client standpoint, kind of pressure testing, like what's their reaction. And I feel like there are some therapists that are like these complete blank slates that are very like more, I don't want to say uptight, but just a little bit more like
that feels
not
cold.
Giving. Cold.
Yeah.
Cold is a good word for it, and like sterile. And
boring.
That I imagine, would be really hard to like divulge something vulnerable and have someone just be like, that's really interesting, or what is coming up, and so I think like Adia, the fact that you say that in the first session, in the intake of like nothing you say is gonna make me run away, scare me, isn't something that I can hold space for, I think already sets up the relationship for people to start to explore the parts of themselves that maybe feel difficult or that other people have not responded well to allow for some of those like corrective experiences.
Yeah.
I do also try and set like the tone and the boundary a little bit different, but that we don't have to get through everything in the first session. So I do feel like sometimes they're trying to like share everything about their lives or about their relationship all in one session. It's a lot to get through. And personally, my style of therapy, I'm like, hey, let's talk about this one thing and really like walk me through it and explain it to me. And we can, come back to these other things or spend a different session kind of addressing these other things, but don't feel like you have to rush through walking me through your whole life experience in one session, because that's also just a lot of pressure on the client and a lot of pressure on the therapist too, of like trying to remember everything after one session. And so taking your time as well. Along with that, and again, it's a little bit different, but I also try and set up a space where if clients also aren't comfortable like opening up about things yet, like I specialize in treating trauma, so I work with a lot of people who have experienced trauma, and sometimes on a really significant level. And so sometimes they come in and they're like I know I have to tell you this, and like I know I have to share this because like what we're going to work on, but like I can almost feel like their own hesitation, or maybe it's avoidance, and I'm like, hey, like you don't have to tell me this today. Like we do not have to utilize this session, even the next session, even the third session, even the fourth, like ongoing, talking about these really like deep-rooted traumas for you. We can start slow, and you don't have to share everything with me right away. And that's okay too, because I do feel like some people feel that pressure of like, I know I have to tell you this, but I personally, I don't know if I would share some things like in the first session. Like it can be challenging. Of course, if you want to, great, but you also don't have to.
Yeah. I love that you said that. I feel like it's all going back to that, like meeting the client where they're at and going, someone said this earlier, Manon, I think it was you, like going at their pace. Like I am not going to force you to talk about something that you don't want to talk about.
Yeah. Well, and I had a kid that I worked with, and there was a trauma. To this day, I still don't know all the details of the trauma, and that's fine. I don't need to know all the details. We would talk about the trauma. We would talk about the incident. Like we externalized it. We did a lot of work on it. And that's partly why I really like EMDR and brain spotting is, we need to know some of the information, but we don't need to have the whole picture painted for us. And so again, like you guys have said, going at their pace, just kind of like, it's like we're walking with them on this journey, maybe pointing some things out along the way, but really letting them guide how quickly or how slowly we move through something, and that's okay. Because even that's healing for them.
For sure. And I feel like that makes me think about too how important it is for the therapist. As the therapist, I think, maybe this is a me thing. I'm always checking it, but I feel like there is this pressure to want to help like as fast as possible. It's like, I want to give you healing. I want to help you. I want to help stabilize. I want to help. And sometimes it is necessary to slow down and go through that slowly. And I think you're actually doing the client a disservice to try to rush that process when they're not ready, or if they're not ready. You end up missing things. So slowing down in general can be really helpful.
Well, like Chantal said, slow down now to speed up later.
Yeah.
That makes me think of Cars, the Cars movie where he's like, turn left to go right or whatever that was. Like, that's what I'm hearing in my head.
I don't even know.
Oh, Cars, that's a cute movie. I mean, we watched it all the time when my kids were little, so it's like burned in my brain along with the Bee movie, but yeah.
The Bee movie.
It's a good one.
My oldest was obsessed with it, so we like watched it probably like 4 times a day for like a year. So like it's like stuck in there. Yeah.
That's way too much Bee movie.
Oh, I was gonna recite a whole bunch of things from it. I stopped myself because I don't want to just like embarrass myself any more than I already have today. So. Oh my gosh. What else would you guys say to a client that's maybe like scared to start therapy that we haven't talked about? I don't know if there's anything else that we would tell a client, but I'm just trying to think of if there were any other things.
Well, one of my questions that I got, or I guess feedback that I got recently that, Lucy, I'm really glad you talked about that, when someone is filling out in their intake documentation that there has been a significant trauma in their life, and whether they're detailed about it or more vague, I feel like I've gotten questions after a couple of sessions where they're starting to feel comfortable and said that they've had some negative experiences with therapists that have either dove too deep into the trauma right away or kind of ignored it and didn't challenge them in some way to open up about it. And so
or maybe had a really big reaction.
Had a really big reaction, and that kind of like closed them off. So I'm curious to what you guys say in an intake session where someone is disclosing something in the paperwork, but again, you want to kind of set the tone of like, we're going to get to it. But like Lucy, you said, it doesn't need to be today and it doesn't need to be all at once. Because I think that puts a lot of people where, again, based on how descriptive or how recent the trauma was, puts them off the defense.
I'll usually ask, like, can I ask about this? Are you comfortable talking about this? And it's okay if it's a no, you know? And so I'll kind of put those things out there and just see what the client's open for. I primarily work with adults, so I don't have to worry about, like, you know, if it's a kid disclosing something with like the mandated reporting and all that. But giving clients autonomy and agency to be able to say, yes, I'm willing to talk about it, or not right now. And I do that whether it's like a question, if it's an intervention like EMDR and brain spotting, you know, anything like that.
Yeah, I both of what you guys said. I will frame it sometimes like, hey, like I noticed you talked a little bit about this in your intake. Is that something that you've done any processing on? Is that something you would like to process more? Just kind of gauging like what, because sometimes there is like a big trauma and a client mentions it in their intake, but they're like, actually, I have done like some work on this already, and I actually feel like this thing over here is more important, at least right now. Like, let's work on, like, this is what I really want to focus on. So I'll ask that question sometimes too, like, what processing have you done already if you have on this? Is that something that you would like to go into more eventually? Or I might say, this is why I think it could be helpful to go into this, not right now, but like at some point. This is, you know, whether that's EMDR, whether that's brain spotting, I might say, like, this is why I think this could be helpful. These are some of the connections that could be there. Yeah. But again, it's not like me pushing that. It's kind
of planning it out.
Like the collaborative gauge of vibes.
Well, and that's where that therapeutic rapport and that safety comes in, because it's like we can start to say that in a first session, and I think that that's beautiful and it's great. And I think the more that the clients feel comfortable with us, it's like, okay, well, I don't really want to walk down that path, but I know I need to and I trust you, so I'm going to go there. You know, and I have clients that like make faces at me. I have clients that flip me off sometimes when we're like doing EMDR brain spotting, but they're like, I know you're right, I just don't want to do it. And I'm like, you don't have to. Like, you can say no, and they're like, no, I need to do it. And so, like, we'll do the work. But it's because we've planted those seeds, like, Adia, like you said, of here's what could happen. Here's how it could be helpful.
Mm-hmm. Yeah. And I can touch maybe on, like, the kid working with a minor, an adolescent, or a teenager. It looks a lot different. I normally, like, never will just directly bring up to the child, like, what is going on. Like, let's say the parents are going through a divorce, for example. That's the beauty, especially when working with, like, a younger child. That's kind of the beauty of play therapy. I will have them engage, and a lot of parents, I feel like, don't know this, but I'll have them engage in some sort of game or action figures or something where, in a way, I'm kind of like, I don't like this word, but like manipulating them into sharing it with me. Like, for example, I'll have them like use little action figures to like show me like everybody in your life. So like show me your family, show me your friends, show me your teachers, and they'll put them all out. And then I'll say, okay, who lives where? And then they'll show me who lives where, right? And then I'll ask them, oh, well, why do mom and dad live in different houses, right? And then naturally, they're going to share that with me. And now it feels like less of a pressure for the child, right? That like they are the ones that shared with me that like, oh, my parents are getting divorced. Not me saying, oh, I heard your parents are getting divorced, right? Developmentally, kids just don't respond well to that. And it's not what works for a child. And so we have a much different approach of opening up these conversations with a child. Like, I have a kiddo that I'm working with now, and we're probably on session number 6. And just for the first time yesterday, we really like actually talked about the divorce, and like he kind of expressed some emotion about it. So that it's just really so different with kids. And so I think it's good for parents to know that too. Like, how is the therapist taking the approach of addressing, you know, this thing with my kid?
Well, and even in that, Lucy, like, you're letting the kid communicate in their language. So if it's action figures, if it's coloring, if it's, you know, something else, it's like you're giving them the tools to be able to speak in their language and what's comfortable without the pressure.
Yeah, definitely. And one more thing I will mention, I think you said something, Adia, about like clients working with a previous therapist. If at any point in their intake paperwork or during the assessment period, they mention that they've done therapy before, I will always like ask clients, what was that therapy experience like? Like, what did you get out of it?
What did you hate?
Did you like your therapist? Because it is important to know, like, if they didn't like direct feedback from their last therapist, that's good information and insight as the clinician to know, like, okay, this is probably not the therapeutic style that I'm going to take with them, given that it's what drew them away from therapy the last time that they did it.
Yeah, I love that you said that. I don't know how that hasn't come up yet. That is such a big one. If a client has that in their paperwork, I'll always ask the question of like, what worked really well and like what maybe didn't work so well. Because I feel like one of the things that kind of immediately comes to mind is like homework. Like, I can think off the top of my head a handful of clients who are like, give me all the things. Like, I want worksheets, I want things to look at, I want, you know, graphs, I want images, I want podcasts, books. And then I have clients that are like, I am swamped, please don't give me homework. And, you know, I had this therapist in the past who, like, this clients who've had this experience of like, I've had this therapist in the past who just gave me homework or like worksheets, and like that really did not resonate for me. So I love that question, Lucy, and I love checking in about that too. And that's part of, I think, just like being a collaborative, like letting it be a collaborative experience and like what works for you, because one size does not fit.
Well, and that's why I think we have that whole assessment period, you know, from the initial consult to like the first 3 to 5 sessions where, you know, it isn't a one size fits all. So we are trying to figure out, okay, what's going to work for clients logistically? What do they have time for? What are they open for? You know, and we have all of these resources and tools, but sometimes clients, like, I'm thinking of a video I could send, but I have a client who like doesn't even have 20 minutes to watch it. So why would I share it? Or if they're already overwhelmed and swamped over here, we're not going to then pile on other things. And so even just using that as an example and then talking to them about, here are things you could do, but we can also do it in therapy. And again, giving them kind of that autonomy and agency to make their own decision, along with us kind of like guiding and sharing about what could be helpful, what we can do to offer help, support, relief, anything like that.
Yeah, I also think it's important to mention too that, like, yes, I will always give my clients, unless I'm doing a specific modality that, like, well, no, even still, I will always give my clients the autonomy and choice to decide if they're going to go home and take the things that we worked on and practice them, apply them, do their homework, all of that. I will say, though, that if clients choose not to, there may be times where we're going to have a conversation of, like, especially when I'm working with couples, like, we keep going home and getting in the same fight. We keep having the same problem. Nothing's working. It's like, well, are you doing the things that we're talking about? Because yes, you don't have to. You don't have to go home and pull out your negative interaction cycle, print it out, put it on the fridge, and use it every time you get in a fight. But then, are you really practicing what you're working on in here? Because 1 hour a week out of the rest of your week is not very much, and you're not necessarily going to grow just from the 1 hour of therapy that you do. You have to do the work and apply it outside of session as well. And so, yes, you can have the autonomy to not do it, but then if you're not making progress, I feel like this applies a lot to couples, especially. If you're not making progress, like, we have to have a conversation then about, like, how much are you doing outside of here to really work on this.
And then at what point do we have to stop therapy because we've given everything that we can do, and like the next part is you guys taking it and applying it and practicing it. You know, and this is where, you know, therapy is such like a cool thing, and I think we all love what we do and we feel so honored to be able to work with the clients that we work with. But it isn't like we learn some information and everything's fixed. I wish it were that easy. Like, it would be great because I think the world would be a whole different place. But it's like we have to learn it, we have to integrate it, we have to practice it, we have to build new pathways, new habits, new routines. And that's, Lucy, when like your clients aren't practicing, they can do it in session, but then like, okay, but where is it integrating? Where is it transferring?
Right, because you need to have those corrective experiences in your life, right? Like, you have to have those corrective experiences that make you feel a different type of experience, sensation, emotion than the negative one that you've been stuck in for 10, 20 years. Your body needs to feel that and be exposed to that, and it can't only be in therapy. It needs to be outside of therapy. I always will, like, even just say things to my couples, like, I wonder what it would feel like if you guys could have this much productivity in a conversation without me here. I wonder how much achievement you would feel, how proud you'd feel, and what would that do for your relationship and just for yourself as an individual to know that, like, okay, like, I can do this without my therapist, and that there's something to be said for that.
Well, and I think also, you know, for clients that are potentially listening to this, that are thinking about therapy, like, we're never going to suggest something that we feel is going to put them in an unsafe situation or is going to cause more problems. So like, we wouldn't suggest that a couple go and do this experiential thing outside of therapy if we didn't believe that they could do it or have the skills for it, you know, or if it was going to be a safety concern. So again, it goes back to that therapeutic rapport of, even if we're not telling you we're constantly assessing and diagnosing and like taking in clinical observations, we are.
Yeah, and that's very true. There will be times where, like, for example, I'll be meeting with a couple and we'll have like a really tough session that day, and they like have a vacation that they're going on that weekend, or they're going to dinner that night, or they have plans with friends or family, and I'm like, okay, like, and I might assign them specific like homework. I might say, hey, you know what, when you guys go to dinner tonight, I don't want you to continue this conversation. I want you to talk about anything other than this thing that we were talking about today. And I do expect them, and it's okay if they don't, but I do expect them to follow those directives, because I'm intentionally giving those directives and that homework, I guess you could call it, for a reason. If I therapeutically can assess that if you guys continue this conversation tonight, it's not going to go well, I'm specifically telling you not to continue it for a reason.
Yeah, and clients will do whatever they want, but, you know, we're always going to give the guidance of here's what we clinically think would be appropriate. And, like, I'll do that after, like, an EMDR or brain spotting session of, like, here's what I would encourage you to do for self-care. And that's going to look different. But, again, it's up to them, you know.
Yeah. And it is. That, like, oh, sorry.
No, go ahead.
I was gonna say on that, even my clients that like homework, and sometimes they come back and they're like, oh, I didn't do my homework. Your therapist is not gonna be mad at you. Like, it's a resource that's for you.
Mm-hmm.
If you keep wanting homework and you keep not doing it, like, we will probably have a conversation.
Right.
That's like what is blocking you from this? Or is there something that's getting in the way? Or is there something that's holding you back? But it's never from a place of like your therapist being mad at you or angry with you or disappointed with you for not doing it. Like, no.
Right. You're not going to get detention because you didn't turn your homework in. Right. Yeah. Well, and I think that's a good reminder, because I think, because it is a professional relationship. We care about our clients. I think our clients care about us in a therapeutic, professional way. And so I do think that there are times clients don't want to disappoint us. And I always tell clients, I'm like, you can't do anything that's going to disappoint me or offend me or make me mad or anything like that. Like, that isn't what this is. And so whether it's I didn't do the homework, or I didn't tell you about this thing because I was really like in my shame, or anything like that, like, we're just here to be open and to be supportive.